7 minutes to 8 o'clock. Welcome back. Now we focus on Pregnancy Awareness Week, and today we'll be discussing fertility. Now, research shows that up to 20% of South African couples may suffer from infertility. Now, the World Health Organization, that's the WHO, ranks it as the 5th highest serious global disability. Well, to unpack this issue and other available options, of course, for those seeking to pursue alternative methods of contraception, we're joined by urogynecologist Dr. Francis Paterson from the Urology Hospital, and I think that's in Pretoria, that hospital. Doctor, good morning. Thank you very much for coming in. Yeah, it's an important discussion. I mean, this is where you don't need to talk about condoms. I just spoke about condoms earlier, because if you want to be pregnant, you don't use a condom. But there are key health issues you need to be aware of as well.
Yes, that's true. I mean, and the latest statistics are saying that about 1 in 6 couples in South Africa are suffering from infertility. So while the vast majority of us are worried about, in our 20s, maybe preventing pregnancy and preventing HIV, there's a significant proportion of our population which is really, really worried about not being able to have a baby. Yeah.
Just describe, what is infertility? Because one hears so many stories about infertility.
So the technical definition is that it is couples that cannot conceive after 1 year of timed regular intercourse. So obviously this doesn't apply to everybody. If you're over 35, if you've got significant medical issues, then trying for a year before you fall pregnant is obviously not an option for you. But a young, healthy, under 35 couple should try for a year. If you can't, and it's not nice to label someone as infertile, that's the thing. So what it means is that if you've been trying for a year, you can't fall pregnant, that's the time to maybe go and see somebody.
Yeah, and we know that in many different cultures, there's all kinds of labels used, particularly against women who are not falling pregnant, and we are saying it's not useful, it's not helpful. Now you've tried, and you've said after 1 year and you're over 35 and nothing is happening, what do you do?
I think that the first step would be to see your gynecologist, your regular gynecologist, get a checkup, talk to them. You know, there might be something very simple that is causing the issue. And then obviously, subsequent to that, the gynecologist will do a couple of tests and just the regular general checkups for you and your, for the female, not for you, for the female and a partner. And then if there's a significant issue, there might be need for referral to a specific center.
Yeah, what kind of things may cause infertility from your experience?
So often, in terms of female infertility, which is more my bailiwick, there are so many causes. In South Africa, one of the main causes is a tubal problem. So people's fallopian tubes become blocked, and it's mainly a complication of infections, STIs and HIV. But there's a myriad of issues that people can have, and they can be structural, like fibroids or cervix issues, or they can actually be that the woman is no longer producing good oocytes, eggs. And on the male side as well, we've got lots and lots of issues. Sperm don't swim well, they're not made well, lots of antibodies, and it can be genetic or environmental.
And of course, when it comes to sperm counts and sperm motility, those things can be sorted out?
Quite easily, yes. Often if it's a genetic issue, if you've got a chromosomal abnormality or translocation, that is quite difficult to sort out. Not impossible, but difficult. But certainly most of those environmental factors are quite easy to sort out.
So if you've got blocked fallopian tubes, a woman, can surgery sort that out?
It depends how long they've been blocked for and how bad the damage is, but there are definitely options for people with blocked fallopian tubes. In vitro fertilization kind of bypasses that. So we take out the egg, we introduce it to the sperm, and it goes straight into the uterus, and it bypasses the whole tube. So it's actually unnecessary. Yeah.
So it's always best that the couple handles these issues together, and they walk this journey together.
Yes, and it's so important that we remember that this is not a fault thing, it's not a shame thing, it's not a guilt thing. It's just something that happens. If you have diabetes, you don't feel bad that you take insulin. If you're not producing good sperm or eggs, you don't feel bad that you're not doing that. It's not your fault. You haven't done anything wrong, and it's easy to sort out.
Oh, thank you very much, Dr. Francis Patterson, urogynecologist from the Urology Hospital in Pretoria, giving some insights there and ideas of how you can manage your fertility or infertility problems during this week, which is Pregnancy Awareness Week.